Good morning, everybody. Thank you for joining us for this wonderful opportunity to get an update from our university experts on international vaccines, and will be an opportunity for us to hear from three of our leaders here at Columbia, and also for our audience to ask questions at the conclusion of each of their presentations. So we will begin in just a minute, and we will have each of our panelists present. If you want, you are welcome to add questions to the chat, and we will turn to the questions at the end of each of the three panelists' presentations. And so without further ado, we appreciate you joining us. Very excited to have our prestigious panelists, and I will introduce them briefly. We first will hear from Dr. El-Sadr, who's a professor of epidemiology and medicine and director of ICAP here at Columbia University. Then we will hear from Dr. Donna Lynne, who's the university COVID director, and then Dr. Melanie Bernitz, who's senior vice president of Columbia Health. And so without further ado, we can turn to our content of the day. I'm going to turn things over to Dr. El-Sadr.
Actually, Julie, I think I'm going to start and then turn it over to Wafaa.
Okay.
Sorry about that. So
no problem. Please go right ahead.
Yeah, let me hold on 1 second. Share my screen. And let's see. Can you see it?
Not yet.
Hold on 1 second. Got the chat open. All right, it's not cooperating. All right, let me just I'm going to do a quick overview, and then I'll turn it over to Wafaa. And one of the things that we want to make sure that you understand is not only what's going on internationally, but what's going on locally here in New York. And we're looking forward to everybody returning to the campus, hopefully sometime over the next several months. You may be aware that President Bollinger announced that we plan a full return to campus in September. And so what we're working on, I think you can see it now, right?
We cannot.
You cannot. All right. It's showing up on mine. Okay. So what we're working on is a plan for the fall that deals with housing, which deals with what classrooms will look like, and many other criteria that, as you are aware of, we implemented when we went into the COVID period that include testing and the like, and you'll hear about that from Melanie. We still have a serious problem in the United States that Wafaa will cover, as well as here in New York, although the campus is very safe. Our positivity rate has been consistently been below 0.5% for all of the asymptomatic testing that we do on the campus. But the city has a positivity rate in excess of 6%. Our hospitalizations are quite high, and we are obviously very concerned about the variants that you'll hear about from Wafaa. We are vaccinating as many of our Columbia affiliates as we can. The vaccine is still not in the amount of supply that we need for the demand. Today is an important day in New York because we are expanding the criteria so that everyone 16 and over will be able to get vaccinated. And our vaccine sites, which up until just a couple of weeks ago, were really run by the city in large public buildings and hospitals and the like, are now physically on campus. So we are doing vaccine administration at Morningside in Lerner Hall and at the medical center in the Black Building, and we'll be expanding to other locations. In the United States and here on Columbia's campus, we have actually access to 3 of the United States approved vaccines, Pfizer, Moderna, and J&J. And as I said, we are providing the vaccine without any respect to, your standing. We hope that when students come back, we'll be able to get them vaccinated. And if they, when they come back and they have been vaccinated from other countries, that we'll be able to honor those vaccines. So with that, I'm going to turn it over to Wafaa to give you a little bit more of an update on the situational data internationally, nationally, and in New York. And then you'll hear from Melanie on testing and changes in quarantine requirements. And we want to try to wrap up for you by 8:30 Eastern Standard Time, so that we can get to as many of your questions as you have. So let me introduce Dr. El-Sadr.
Yes, hi, good morning, good afternoon, good evening, everyone, and pleasure to be here. And thank you, Donna. Let me share screen and hope it works. Never know. Do you see it? Screen now? Okay.
Yes, it's working. Yeah.
Okay. So I'm going to really focus on the vaccine update, but I also will give a very brief sort of update on the pandemic itself to set the stage. So as you're well aware, the pandemic continues to grow. We now have more than an estimate of more than 131 million cases globally, and more than 2.8 million deaths have been reported from various parts around the world. What's interesting is when you look at the numbers of cumulative numbers of cases that have been reported thus far, the majority have been reported from the Americas as well as from the European region. And then you can see the smaller proportion of cases that have been reported from other parts of the world. Interestingly now, the top 5 reporting countries globally are the US, and the US has been the country that's reported the most numbers of cases consistently for many, many months in a row, followed by Brazil, India, France, and Russia. In terms of what's happening in the US and New York City, as Donna mentioned, we continue to have a serious pandemic here in the US. As you can see in this slide, there have been more than 30 million cases reported in the US, and more than 555,000 reported deaths. And the US has experienced 3 surges, as you can see in this curve here. The last surge was observed over the winter holidays, and now the US is at still reporting large numbers of cases at this high plateau in terms of numbers of daily cases. New York City, on the other hand, has also had a similar high burden of disease, with more than 64,000 reported cases and more than 31,000 deaths. And New York City has experienced 2 surges in this pandemic, and similar to the US, the one associated with the winter holidays, and is now reporting cases at this very high plateau as well, with between 3,000 and 4,000 new cases reported every day. So let's move on to vaccines. And the good news is that in terms of vaccines, there's a very robust, excellent pipeline of new vaccines that are being identified on a daily basis. And these vaccines all go through different phases in research development. And then once we have the results from what is called phase 3 studies, and these are large studies that include between 20 and 40,000 participants. And these studies are designed to demonstrate, to show whether the vaccine works and also how safe it is. And then once we hear the results of these phase 3 studies, these vaccines then move on to either being authorized or approved in various countries around the world. So we have a lot of vaccines that have been, that have undergone and went through these phase 3 studies. And I'm not going to go through these details, but you can see in the slide the name of the vaccine, the type of vaccine, and then the doses required to be taken for optimal immunity, and then some of the results from these phase 3 studies. The first 2 vaccines here are the Moderna and the Pfizer-BioNTech vaccine. These are the first 2 that have been approved, authorized for use in the US. And they both use a new platform called the mRNA platform. And both of these have very, very high efficacy at 94 and 95%. In addition, there are also several other vaccines that use a different platform in terms of developing these vaccines, and they use what's called a vector, an adenovirus vector, which is a very benign cold virus to be able to actually go into, to carry the SARS-CoV-2, the virus, the coronavirus protein into the cells to develop the immunity. And then there are other kinds of vaccines that have also been developed as well. You can see here that thus far, these results in terms of the vaccine efficacy, what is VE, has been really good. All of them here show that vaccine efficacy of over 60%, which is the threshold that the US Food and Drug Administration has set for determining efficacy. And then there are other vaccines also from around the world. Some of them, again, adenovirus vector, two of them here, one produced in Russia, the Jamalaya Sputnik 5 vaccine, as well as also one of the vaccines developed in China, and then some other vaccines that use inactivated virus to stimulate the immune response. So we have a lot of vaccines, fortunately, that have been shown either that have been shown to work and have been shown to be safe for use in humans. Now, in the US, there are three that are being used now. As Donna mentioned, there's the Pfizer, BioNTech, and the Moderna vaccines that I mentioned before. These require 2 doses. And then there's the Johnson & Johnson Janssen vaccine, different kinds of vaccines. And the major advantage of this vaccine is that it only requires 1 dose, and it's easier to store when compared to the Pfizer, BioNTech, and the Moderna vaccines. But all of these are well-tolerated and effective vaccines. Now, in addition to the ones, so these have been authorized by the Food and Drug Administration for use in the United States. Now, what about globally? There are several vaccines that have been what we call pre-qualified for emergency use by the World Health Organization. And as you can see in this slide here, 3 have already been authorized. These include the Pfizer-BioNTech vaccine, the Johnson & Johnson Janssen vaccine that I mentioned before, and the Oxford-AstraZeneca vaccine. These are already been assessed and pre-qualified by WHO. It's also anticipated that by the middle of this month that the following vaccines should also be pre-qualified, hopefully the Moderna vaccine, the Sinopharm, and the Sinovac vaccine. And why is it important for vaccines to be pre-qualified by the WHO? Is that that's a necessary step so that these vaccines can then be available to be procured for several countries around the world through the mechanism that's called, an initiative that's called the COVAX initiative, which is focused on enabling access to vaccines in low and middle income countries. And COVAX will only procure vaccines that have been pre-qualified by WHO. Now, we also, beyond these phase 3 studies, the good news is that there also are real world data that are very reassuring in terms of showing us that these vaccines actually work. And I'm not going to go through the details on this slide, but just to share with you that, for example, for the Pfizer-BioNTech vaccine, we have data now in populations through mass vaccinations in Israel, for example, through testing on and evaluation of older individuals that have been vaccinated in England, as well as also through programs that have focused on vaccination of US healthcare workers and essential workers. And by following these individuals who have been vaccinated, what the data are showing is that the risk of developing of getting infected with SARS-CoV-2 or development of symptoms of COVID-19 or hospitalizations or severe illness, that these risks are markedly diminished among individuals who have been vaccinated versus individuals who have not been vaccinated. We also have as well evidence from the Oxford-AstraZeneca vaccine, also at a community level amongst older individuals in England, similarly that those who were vaccinated were much more likely to develop symptomatic COVID-19 or to be hospitalized. I think these real world effectiveness data are very important because they take the efficacy that was shown in these phase 3 studies to the next step. So what's happening now globally? So this is a map that shows the vaccine current procurement and planned procurement of vaccines for various countries around the world In this blue color are countries that are using multiple vaccines. For example, the US, as Donna mentioned, availability here of 3 vaccines, and several countries in South America and Asia as well, and Europe are using multiple vaccines. And then you'll see some other countries that are, for example, several African countries are procuring now the AstraZeneca, solely the AstraZeneca vaccine, as well as there are also some countries in South America as well as in Southern Africa that are solely utilizing the Sinopharm vaccine from China. In addition, you'll see also there's several countries that are solely focusing on the use of the Jamalaya Sputnik 5, the ones in orange here. Now, what about the groups that are being currently vaccinated? And you will see that most of the countries in this map here are focused in this purple color are countries that are focusing on multiple groups. But on the other hand, you'll also see that several countries are at this point focusing on healthcare workers and essential workers. And most of the countries around the world are starting their vaccination campaigns by focusing on healthcare workers, essential workers, similar to this country, for example, and then expanding to other populations. Now, how are we doing in terms of vaccination globally? A lot of diversity, as you can see on this map here. Vaccination per 100 person. Obviously, the darkest green means the highest rates of vaccination. And the darkest green, you can see the US and Chile, as well as in the UK and Israel and the UAE, several countries around the world. And then you can see in lighter green, a lower level of coverage at this point. And then there are several countries in very light green that have just started some of their vaccination campaigns. So we need to watch, and we watch what's happening over time so that we can hopefully overcome the disparity that's being observed now between countries as well as also within countries. I'm going to be very briefly shift to variants, the SARS-CoV-2, the viral variants. Why do variants matter? I think the virus, as it goes from one person to the next, as it multiplies, the virus makes mistakes, and that causes the development of mutations. And then these mutations lead to a new kind of a virus, a new variant. And what's of most concern are the mutations that occur here in this orange in part of the virus, in the part of the virus that's the spike protein of the virus. And these mutations in the spike protein are very critical because it is the spike protein, it is that part of the virus here that actually latches onto our cells in our body. So that's the fear, is that as these mutations happen in the virus, that they will enable the virus to either be more easily transmitted and make it more able to get into our cells faster, and so on and so forth. So there's several variants of concern, and just to share with you some of them, this is the B117 variant that was first detected last September, first in the UK, and has now been detected in more than 90 countries around the world. And the concerns about this virus is that it appears to have increased transmissibility, easier to transmit from one person to another, as well as also seems to have higher risk of severe illness and hospitalization. Then there's another variant, the B1351, which was detected in October, first detected October of 2020, and that was first detected in South Africa, and now has been detected in more than 48 countries. And the concerns are increased transmissibility again, as well possibly also this variant, this mutation results in a reduction in the vaccine efficacy, meaning that this variant appears to kind of have learned how to possibly outsmart our vaccines. And then there's the P1 variant that's first detected in Brazil, now in more than 25 countries. And there's a lot of concerns about this variant with increased transmissibility, possibly reduced virus vaccine efficacy, the ability to overcome immunity after infection by another virus as well. And then the B1526, which was first detected in November of 2020 in New York City, and has been increasing in the rates of detecting this variant It has not been detected in other countries as of yet, and the major concern as of yet is that it has increased transmissibility. And I think as many of you will ask, what's the importance of these variants? I just will focus here on, for example, the Pfizer-BioNTech. What people have done, researchers have done, is to do laboratory tests here by looking at the antibodies that are produced in people who are vaccinated and see if they still work against this variant. And you can see that with these variants here, the three that I mentioned to you before, is that it looks like there's a decrease by twofold or even sixfold of the neutralization, the effectiveness of these antibodies that are produced by the vaccines. But nonetheless, the good news is that in clinical studies, the vaccine appears to work really well. So you have to look not just at the laboratory data, but also as to the clinical experience in terms of the effectiveness of the vaccine against these variants. I'm going to end here with a few conclusions. I think, as you know, as I've told you, that the vaccines offer very clear public health, life-saving benefits, with all providing protection against symptomatic COVID-19, hospitalizations, and death. We all know that now all of these vaccines have some degree of protection against these SARS-CoV-2 variants, with the majority still being highly effective. And the data show that also vaccination provides, there's increasing data provides some degree of protection against asymptomatic infection, which is very important. We don't know the duration of protection of many of these vaccines as of yet. They're fairly new, though there are recent data that has shown that the Pfizer-BioNTech vaccine appears to remain effective at least 6 months after vaccination. And of course, most importantly, is we need to expand efforts for access to vaccines, while at the same time trying to decrease transmission of this virus through the other preventive measures that we all know. And that the evolution of these new variants can really threaten the control of the spread of this virus, as well as lead to potentially severe cases and may compromise the efficacy of our vaccines and treatments. So thank you very much, and I'll hand it over to Melanie. Thank you.
Thank you, Wafaa, and good morning, good afternoon, good evening, wherever you are. See if this works. You can see my slides?
Yes.
Great, okay. Thanks for having me. So my role, I oversee the student health services here on the Morningside campus. So my team is very much involved with testing, contact tracing, quarantine isolation, and now vaccination. So I'll be covering some of that for you today. As Donna mentioned, our campus picture is actually a whole lot better than the New York City situation that Wafaa described. Since June, we've done over 207,000 tests on campus, and our cumulative positivity rate is just 0.39%. We also do random surveillance testing, which I'll talk about, and that gives us a real prevalence estimate. And this has been very low. You can see from the last week was just 0.37%. It's been as low as 0.15%. So again, below the ranges we see in New York City. And this is really a very strong indicator of the safety of our campuses, and that all the measures we've put in place do keep us safe as we are back on campus. We are responding to positive cases, both that we test and that test outside, and I'll talk about our contact tracing team. The routines haven't really changed in the last year for those of us who've been on campus even since last March. The requirements are still the same, and even as we've seen other changes around vaccination and testing, we keep these same routines and requirements because they really are critical in keeping us safe. And these apply whether you're on campus or at a WeWork site or at a global center. And it's really the reminders to keep your distance, wear a mask, stay home if you're sick. And it really has become this shared responsibility for community health. And that we all know that as we continue to take these measures, they're keeping us safe both on and off campus. And we are continuing to review these as the situation changes. Hopefully, as we see case rates go down and vaccinations go up, we will make changes to this. But right now, these are unchanged. We still have the same requirements for masks and distancing and gatherings on campus. Paired with that is the daily attestation. When you come to campus, you will download the Reopen CU app. It's become a very routine part of our day. You know, you get up, you brush your teeth, and you complete your app. And this allows us to really monitor whether or not we should be coming to campus on a given day. It asks 4 simple questions about exposures, symptoms, travel, close contact. We've updated these questions as requirements have changed. And you either get a red pass, which means stay home, or a green pass, which gives you access to campus. And that is linked to your ID badge. So if you have a green pass, you will be able to swipe into campus. If you have a red pass, you will not be able to swipe into campus. It's also linked with our testing and flu vaccination. Just a quick reminder here that the covid19.columbia.edu website is dedicated to all things COVID. So make sure you bookmark that site. Anytime you have a question, go there. There's hundreds of FAQs, there's a chat bot, and we put all our real-time data updates there. Updates and messages on testing, vaccination are there. So it's really your best resource to get quick updates. So real quick, just to cover testing, we've been testing on campus since last June, and our approach has been evaluated continuously. We made many adjustments to that testing program. We get input from epidemiologists, modelers, statisticians, infectious disease specialists, public health professionals, and we've been very flexible as the situation both on campus and in New York City has changed. So we do adjust this, and we will continue to adjust it. We do have 2 large-scale, high-throughput testing sites, one on the Morningside campus in Lerner Hall, and the other at the Medical Center campus in the Black Building. We're routinely doing over 1,500 to 2,000 tests a day across our testing sites. Everyone currently is required to get what we call a gateway or a re-entry test. And that means the first test on campus when you first arrive on campus is your gateway test. You automatically have a red pass on your app until that test is completed. So the first test you do is your gateway test. That's then followed by ongoing surveillance testing, which, as I mentioned and showed the numbers, is really important in assessing our campus prevalence. The one kind of testing we don't do in these large-scale sites is symptomatic testing. That's for obvious safety reasons. If someone has symptoms, we want them to be evaluated by a clinician. So reach out to student health, either on the Morningside campus or if you're a CUIMC student on their campus. They'll evaluate you, and both sites have the ability to do rapid testing on site and give rapid results to students. So the surveillance testing, we encourage all our graduate students to get weekly testing or testing as they wish for travel-related testing. But we do have a requirement for 10% of our population per week are randomly sampled. So that means we look at who's been on campus and we select 10% per week. They get an invitation to come in for a test. And this is required during the date range that the email states. And so if you get that email, you must test within that defined time period. And that if you don't test, that is linked to the swipe, you will get a red pass until that test is completed. The summer term starts beginning of May. Right now, our summer testing is likely to look the same, but we are evaluating it, and we are working with our modelers and epidemiologists on the fall testing plan. So right now, I can't tell you exactly what that will look like because we are taking into consideration the rates of infection, vaccination rates, and the variants as we design the fall testing program. But we will have some element of testing on campus. The testing is linked with contact tracing. That allows us to quickly identify and suppress transmission of the virus. So when someone tests positive, our contact tracing team reaches out right away and asks them who they had close contact with while they may have been infectious. We then go to those close contacts, and without revealing the identity of the person diagnosed, we notify the close contacts of their potential exposure, and we ask them to self-quarantine for 10 days. This is all a very confidential process. We don't share this information, but our tracers do obviously now take into consideration vaccination when they do contact tracing. We have a large team. We work in partnership with Columbia Health, with ICAP at the Mailman School of Public Health, and this team does work 7 days a week to rapidly contact trace. We know about the results for those who test positive on campus. If you test positive outside of campus, we ask that you email us at covidtesttrace@columbia.edu so that we can initiate contact tracing as well. There have been a lot of updates in New York State regarding travel. The first big update that just started last week on April 1st is around domestic quarantine. Prior to that, anyone returning from domestic travel to New York State was required to quarantine. That has now gone away. There is no domestic travel quarantine requirement when arriving in New York State, though obviously still recommended as a precaution, but no longer required. There are also multiple changes happening around international travel. There is a mandatory quarantine requirement for anyone coming to the US internationally, with some testing before arrival and then testing afterwards. There is some updated and different guidance for those who are fully vaccinated. So it's certainly worth reviewing. This is changing on a daily basis. So please review prior to your arrival to see what the current status is. New York State does keep their site updated, and all travelers are required to fill out the New York State travel form, regardless of whether or not they are required to quarantine. So the big question is around vaccination. We've seen a lot of questions in the chat about that. I think the biggest thing for us to emphasize is that supply is limited. The federal government allocates vaccine supply to the states. The states then allocate that to various jurisdictions, including New York City, and then New York City then allocates that to the provider. So this isn't just that Columbia can go and order vaccine. We're really limited in terms of what we get, and we don't know what we get till the week of. So that's why you don't see a lot of appointments. We were able to open up the Learner vaccine site last week for very, very limited quantities, and the same is true this week. And as Donna mentioned, the Black Building site is also open with very limited quantities. As that availability grows, you'll see appointment access grow. For the Learner site particularly, the way we are scheduling for that is the same as you schedule your testing appointment. So it's using the online patient portal, and messaging will be going out to the university this week around how to schedule those appointments. But again, we're only releasing them a day or two in advance because it is based on supply. So if you log on now, you won't see any appointments, but potentially if you log on tomorrow, you may see some appointments for Thursday. So please check back. And also don't just rely on our university sites. Use the New York State Am I Eligible site, and you can then go and see sites across the city, as well as using the site Donna mentioned, Vaccine Together NY, to look at the New York, the Columbia Doctors sites and New York Presbyterian sites. So we really recommend get the first appointment you can get. Don't necessarily wait for hours, and continue to check back. Today, as of 8 o'clock this morning, eligibility in New York State expanded to all of those 16 and over. So you can imagine today there's a big run for any appointment, and they're getting snapped up real quick. But as I say, as vaccine allocation comes, more appointments will become available. Just one reminder, as you come back to campus, we do have extensive resources for our student community on both campuses. And please remember, many of these services are not only available in person, but virtually as well. So this includes our medical and our counseling services, as well as all the health promotion, disability services, sexual violence response, and insurance. We have a lot of offerings, including group programs. So please be sure to go to the website so you can see what's available to support you, whether you're on campus or further away. So I hope that's given you an indication of all that's available. Thanks for having me, and I will turn it back for questions.
Great. Well, thanks to everybody. We do have a pretty consistent set of questions that we'll turn to Wafaa, and I think we can answer a number. Please put your questions in the Q&A box. We've been emailing specific answers, but a lot of the questions really relate to, Wafaa, your recommendation about people getting the vaccine in the country that they currently reside in. Should they complete that, number one? And number two, would they be getting a third dose when they come back to Columbia?
Yeah, I think, let me try to answer this, and there's some things that remain unclear as of yet, but I would say to anyone, wherever you are, if you have the opportunity to get vaccinated or offered vaccinated or become eligible for vaccination, please do get vaccinated as soon as possible. That's the recommendation. It is in order to protect you as quickly as possible from getting infected or from getting COVID-19. I think, and then please try to complete the course. If it's a 2-dose vaccine, as most of them are, please, again, make sure that you do get the second dose as well. In terms of what's going to be required on coming back to campus, that remains a little bit unclear at this point in time. We know that this is under discussion in terms of which vaccinations would be acceptable as evidence of effective vaccination. It's of course all of those that in the US that have been approved by the US FDA are of course clearly going to be acceptable. And we're now discussing, for example, whether if a vaccine is under the WHO pre-qualified list that I showed you on one slide, whether we would these would be acceptable as well upon arrival here at Columbia. So stay tuned.
Wafaa, there are also questions about the vaccines. Well, we stated that there were 3 vaccines approved in the United States. A number of the attendees are getting different vaccines, and the question is, will they be honored by Columbia?
Well, like I said, again, it's going to really depend on which vaccine. If you're getting any of the vaccines that are approved now in the U.S., that's a clear answer is yes. If you're getting Pfizer, BioNTech, or Moderna, or again the Johnson & Johnson Janssen vaccine. I think the other vaccines, like I said, I encourage everyone to get vaccinated again as soon as possible, and then we will look at the WHO pre-qualifying list later on in the year as people are coming back to campus, and then determine whether we would accept the vaccines that are on the WHO pre-qualified list.
But I think one thing to emphasize, Wafaa, that you already mentioned is if you have the opportunity to get vaccinated, you should complete that.
Absolutely, get vaccinated, yeah. And there are lots of other questions that arise also, Donna and Julie, like what if I get 1 dose of one, and what do I do about the second dose? And that's an unknown. And that's the reason why I encourage people to actually get the full regimen, the 2 doses from whatever vaccine they're getting, because we really don't know as of yet whether one can mix and match different kinds of vaccines, and whether that's effective and whether that's safe. It remains an unknown.
Melanie, I know you're busy. We're all trying to monitor the Q&A box at the same time. There's actually 2 questions now about the requirements for international students coming back to campus. So maybe you could answer them live. We'll save you the typing.
Save me the typing. So right now, for most people, there is a required quarantine upon arrival in the US. And there's 2 ways to fulfill it. It keeps changing, so I hope I'm getting it right. If you test 3 days prior to leaving your home country, when you return to the US, you can do a 7-day quarantine, but you are required to get a test around day 5 of that quarantine to test out. Otherwise, I believe it's a 10-day quarantine without testing. That's for the majority of people. There are some changes happening with vaccination, which may reduce that requirement, but the safest option is to try and test before arrival and then have a shorter quarantine upon your arrival with a second test. I should add that if you are in the New York City area, you can do that post-travel test at our testing centers, even though you'll have a red pass on your app. The red pass, you have to answer, yes, I've traveled recently and I'm under quarantine, and get a red pass, but that is the one of the red passes, should I say, we will allow into the testing center. So even though you're not actually allowed to be on campus with a red pass, because a test is a medical appointment, we do allow that. So don't worry about having to get that test somewhere else. You can schedule that with us.
Wafaa, a question in the box is, are mRNA vaccines compatible with inactivated virus vaccines?
Well, I think that's the issue about the mixing and matching of different vaccines. And the answer is we don't know the answer to that question. And that's why we strongly recommend that people complete the regimen, meaning make sure to get if it is a 2-dose vaccine, that you get the second dose of the same vaccine, because that's how it was studied, that's how it was approved. So it's really important to use these vaccines as they are recommended now by the FDA or WHO. So we are not supportive, and most experts would say not to mix and match, but to work very hard at trying to get the 2 doses of the same vaccine.
Great. Wafaa, another question for you, which is, do you have a recommendation? If you had the choice of J&J, Pfizer, or Moderna, what would you do?
I would get the one that is offered to me first. I think it's this applies to people in the U.S. as much as it applies to people in the international context. Is if you have an appointment and you go and to get vaccinated, take whatever they're giving.
Great. Melanie, I know you covered it, maybe just a little highlight again. There is a question about the requirements for students coming back in September, which are multiple.
Yeah. So there will be a testing requirement. The gateway testing will be required. We assume things could change by then, but if it is required, we will be offering it on campus. So that's testing. Regarding vaccination, as we've shared, this is still being discussed at the university level in terms of, is there a vaccination requirement or not? So we will certainly give people advance notice. And again, our anticipation is we will continue to offer vaccinations on campus. So those who need them, whether or not it's required or just, voluntary, that we'll continue to offer that as long as we're able to get supply. Similarly, the daily requirements, the checking the app, for now, still all in place. Obviously, we continue to review the situation. Things change rapidly, and we'll update the population, our community, as things change.
Right. We did get a question in the chat box, not related to the vaccine, that maybe I just want to share with everybody, which is, what is the fall going to look like? So we, at this point, right now, we expect a full return to university housing for undergraduates. So we'll be at capacity. The President Bollinger, and there is a link on our website for a letter that he sent out to the community about 2.5 weeks ago that stated that we will have a full return to campus. And right now we're working on classroom schedules and how we will accommodate, as Melanie said, we expect not only face covering, but physical distancing to remain in place throughout the rest of the year. One dynamic that is happening in New York is that the mayor declared that for K through 12 students, you can have 3 feet of distancing. That doesn't apply to the university. If that is extended, it gives us a lot more options for in-person classes, but we're working to accommodate as many small to medium-sized in-person classes as we can. Obviously, lecture halls, by definition, are harder to accommodate, but we're working on flexible schedules, and those will be released in the coming weeks to month. One other thing which we didn't highlight, which is our travel policy. I know travel is for the international, for all students and for faculty and staff, we've had fairly restrictive travel policies. We will be posting on our website today, COVID-19 website, the new travel policies for the summer. And we have loosened many of the requirements, both for personal travel, domestic and international, as well as for Columbia sponsored travel. That was just approved by the president yesterday. So we're tuning it up. And if you go to the website, hopefully by tomorrow, you'll be able to see how effective June 1st we'll be approaching travel. We'll be watching the situation both in New York, the United States, and as Melanie said, we have a lot of rules that we follow that are not just Columbia rules, but that are government rules, and obviously what's going on internationally. And so for the fall, we anticipate that some of those travel updates will be made by no later than July to give people advance notice. Yes, masks are still required for in-person classes. We're going to anticipate that in the fall. Let's see, Wafaa, I don't know if you've seen, we've got the first jab and second jab question, which is not about different vaccines, it's about Pfizer. And I can tell you that the challenge is we are allocated 2 doses. When you have a 2-dose regimen, we get allocated the dose. Your personal name isn't on it, but it may as well be. So we know who how many people have gotten first doses. We're then allocated second doses based on the first doses we administer. It is pretty hard unless there are extenuating circumstances to get a second dose here when you got your first dose somewhere else. I will tell you that we have had some hardship cases where we've been able to do that. But if you can stay where you are and get your second dose, that would be highly recommended. Wafaa, we have, will Coronavirus from Sinovac apply as a vaccine?
Well, I'm sorry?
I'm trying to understand the question. Maybe, I think Sinovac is a question as to whether or not we would accept that.
I think we are awaiting, as I showed you in my slides, is that vaccines, several vaccines are awaiting being to be pre-qualified by WHO. So that would be an important step in order for us to consider whether such a vaccine would be acceptable as evidence of vaccination. So several companies now are submitting their data and so on to the WHO for review in order to get the pre-qualification from WHO.
Julie, maybe, yes.
Yeah. I was going to jump in. Yes, thank you for perfect timing. So thank you. We had, over 25, 26 questions answered throughout. Thank you all for such a robust discussion of kind of the state of the world, both in terms of testing, vaccination, as well as what's happening here on campus. Please stay tuned. I believe that Melanie put in the chat the link to the COVID website, and it was in her presentation, as information becomes available, and it will continue to be updated as the public health conditions and requirements continue to be updated throughout New York City, on campus, and the globe. So this is a changing situation. We plan to host another webinar specifically for our international students as we get a little closer to summer and people are beginning to make their travel plans. So we plan to repeat this again and keep you all updated and posted as information becomes further available. So thank you to our panelists. I'm going to turn things over to Safwan Masri, who heads our global centers, to say a few words, perhaps ask a question of his own, and thank you. Also, just a note that this session was recorded. We will post this on the Global Center website, so you'll be able to view this and share it with others if you'd like. So thank you again for joining us, and Safwan, I'll turn it over to you.
Thank you very much, Julie, and many, many thanks to Wafaa, Donna, and Melanie. This is always incredibly important information, very fascinating in terms of how it continues to evolve, and we continue to learn new things. Thank you to the students really for participating and for the great questions that you've asked. Keep asking us those questions. Keep going to the website that Dr. Bernitz just put in the chat box. Come to the Columbia website and check information as it becomes increasingly available. As you've heard, for example, the Center for Disease Control made some new policies, new guidelines last Friday about travel and quarantine. New York State is expected to follow with its own policies over the next few days, which will impact, of course, everything that we know and everything that we're hearing. We expect to, with the generosity of the time by Donna, Melanie, and Wafaa, we hope to be doing this perhaps on a monthly basis. And so even if you've tuned in today or to a previous session, tune back in, because as we said, this is information that's constantly evolving. And I do want to just underscore something that Dr. Bernitz said, which is, please, 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 wherever you are going to study, whether it's at a global center or at a WeWork site, observe all the health and safety measures that are in place. Keep your physical distance, wear your mask, whether you're vaccinated or not. I mean, these are very important steps that we need to continue to observe and also get used to, because once we are back on campus, this is how life is expected to look like in the near future. I think, the students asked all the great questions, and you've covered so much that I really don't have any additional questions. I guess, one thing that I'm sympathetic to on the part of the students is there's so many vaccines out there. So Wafaa, your responses about what's expected is very, very helpful. We hope to get to a point where at least most of the vaccines that you had in your slides are accepted by us on campus. And, just to the students, exercise your best judgment. And if you have access to a vaccine, just take it. And if you're in the UK and you're taking AstraZeneca, or in other countries like in Jordan, where I am now, where AstraZeneca is administered with 12 weeks between doses, just get the first dose as soon as you can and plan your travel after you receive the second dose. I think what you're hearing is it's best if you have both doses before you come to the US. Am I correct? But if for whatever reason you have one dose, then that should be okay. But clearly it will be much easier in New York for us if you've had one dose of Pfizer or Moderna. But if you've had your first dose of AstraZeneca, it probably is best to wait out and get your second dose before coming back. Am I correct in this, Donna, Melanie, Wafaa?
I think it's important, even if it's a Pfizer one dose, and like Donna mentioned, it's not easy to get a second dose to someone who's gotten a first dose somewhere else. So I think, again, think ahead, plan ahead, like Safwan is saying, and if you can get vaccinated as soon as possible so that you are able to get the second dose before you come back to the United States.
Thank you. Thank you. I'm glad I posed that as a question. So try to get both of your doses before you come back to the US. So thank you so much again, Donna, Melanie.
Safwan, can I interrupt you? There's a question in the chat before we close that's asking a bit about the Columbia Global Centers and WeWork Pass and plans for the 2021-22 academic year. So I just wanted to put that to you before we close.
So much. Yeah, thank you so much for bringing that to me. We don't know yet. We're trying to assess where students are going to be, and we're hoping that most of you will be back on campus. We're trying to find solutions for the summer. It's too early, but we're trying to find some solutions that we can make available to you, even if it's not in the form of WeWork designated spaces, to at least make access passes available to students who want them. And we're working with WeWork on trying to make those access passes functional on weekends and in the evenings. For the fall, I suspect that if we continue to have international students, in particular Chinese students who are finding it difficult to come back to campus, then we will create a solution for them. So just stay tuned. We hope to have more information in a couple of weeks about the summer, and we'll just reevaluate the situation every semester, but we will continue to do everything that we can to provide you with access.
Excellent. Thank you, everybody. I think that concludes our talk today, and I really want to thank the panelists and everyone for joining us and for the great questions. I think kept everybody busy for the full hour answering questions. So thank you. And again, we will return to this forum to continually update you as information both internationally on campus and in New York continues to change. So thanks everybody for joining us today.
Bye. Thank you.